A petition demanding the government to close the borders has skyrocketed overnight. In today's video, we will be going through the details on this, whilst also going over all of the latest news from up and down the country. But first, hit the like button and subscribe to the channel and join our fast-growing community. There's a new petition circulating, and it's gained significant attention online, surpassing the 100,000 signature mark needed to be considered for debate in Parliament. Although it's not growing as quickly as a previous petition calling for a general election, unsurprisingly dismissed by MPs, it's making waves. As of now, on this Sunday afternoon, it's reached 176,000 signatures, which is a pretty big deal. This petition is bound to cause problems for Keir Starmer and the Labour government. It calls for the UK to close its borders and halt all immigration for 5 years. According to the petition's creator, Aaron Gallagher, the country is struggling to cope with challenges posed by both legal and illegal migration. He argues that suspending immigration is the only way to address these issues effectively, given the strain on resources and infrastructure. There's some truth to these concerns. The UK is a relatively small island with a growing population, and our infrastructure is already struggling to support those who live here. Yet the Labour government continues to encourage immigration, doing little to address the issue of illegal crossings from France. On Christmas Day alone, over 400 migrants arrived in small boats. So much for tackling people smuggling gangs. Mass immigration brings challenges that can't be ignored. Economically, it can suppress wages, especially for low-income workers, by increasing competition for jobs. This creates resentment among those already struggling. Then there's the housing crisis. Migration puts significant pressure on an already overstretched housing market, driving up prices and rents, making it harder for both migrants and native residents to find affordable accommodation. Moreover, while immigration might boost overall GDP, studies suggest it often has little impact, or even a negative one, on GDP per capita. In other words, the economic benefits aren't always felt by the average person. Social cohesion is another issue. When large groups of migrants settle in specific areas without integrating, it can lead to segregation and tensions between communities. This undermines the very idea of immigration as a mutually beneficial arrangement. Why move to a country if there's no intention to integrate? Public services are also under immense strain. The NHS, for example, is buckling under the pressure with longer waiting times and insufficient resources. Schools are overcrowded, making it harder for children to receive quality education. And in the justice system, trials can become more complex and costly when interpreters are required for multiple defendants. Security concerns add another layer. Vetting migrants and ensuring proper background checks can be challenging, raising fears about national safety. Meanwhile, requests for data on migrant-related crime often go unanswered, fueling public distrust. Brexit itself was arguably driven, in large part, by frustrations over mass migration and a perception that the establishment wasn't listening to voters' concerns. The current government seems no different, and public frustration is likely to reach a boiling point if these issues remain unaddressed. This petition isn't about racism or xenophobia. It's a call for practical solutions to real problems. Yet, it's almost certain to be dismissed in Parliament, as no government, especially this one, wants to risk being labelled as discriminatory. But let's be clear, you can't keep a country running effectively when the infrastructure is failing, public services are stretched to breaking point, and tensions are rising. It's like running a shop with rotten shelves, outdated stock, incompetent staff, and holes in the floor. At some point, you have to shut it down, fix it, and make it viable again. This petition could get millions of signatures, and Parliament would still ignore it. But the underlying issues remain, and unless something changes, the situation will only get worse. Migration can bring benefits, but only when it's managed properly. Right now, the system is broken, and the government seems unwilling or unable to fix it. I'll leave a link to the petition down in the description. In other news, hundreds of transgender hospital patients were recorded as female in NHS records, despite having medical conditions that only affect biological males, new analysis has revealed. Data from hospitals in England and Wales suggests that 482 patients were logged as women, despite being admitted with prostate, testicle, or penis-related conditions in the year to March. The figures emerged from analysis of hospital admissions data, highlighting cases where patients with male-specific medical issues were documented under female gender markers. The Sun reports. The largest group among these cases involved 263 patients who were admitted with prostate hyperplasia, a non-cancerous enlargement of the prostate gland that cannot occur in biological women. A further 85 patients were recorded as female despite being treated for prostate cancer. The data also revealed 48 cases involving disorders of male genitals, where patients were logged as women in hospital records. Current NHS rules permit transgender patients to have their gender changed on databases while maintaining separate patient records. There's pressure on staff not to offend patients, one GP told The Sun. The same GP added, but the fact they are recorded as women in the statistics is ridiculous. The recording of gender identity in hospital statistics has raised questions about medical record-keeping practices within the NHS system. Conservative MP Sir John Hayes responded to the findings, stating, "You cannot change biology." It is an immutable fact that these conditions only appear in biological men, he added. Hayes further criticized the health service's approach, saying, "The fact the NHS is pandering to this is nonsense." In response to the findings, an NHS spokesperson said, "These statistics report the gender registered by patients and therefore include trans women, with further patient details included in their health records." Lastly, King Charles and Princess Anne attended a Sunday church service at St. Mary Magdalene Church in Sandringham, just days after hosting the royal family for Christmas. The monarch appeared in high spirits as he greeted onlookers, dressed smartly in an olive green coat, charcoal grey suit trousers, and brown suede loafers. Princess Anne cut an elegant figure in a blue pleated skirt and matching wool blend suit jacket, complemented by knee-high suede boots and a navy wool hat. The Princess Royal added a splash of colour to her ensemble with a vibrant red scarf. What are your thoughts on what we discussed in today's video? Let me know down in the comment section below. If you've not yet already, make sure you do drop a like on this video and subscribe to the channel for more British content. Thank you. Take care. Goodbye.